you. Okay, so I'll just take that again. The topic today is challenges some adoptees have and solutions. And it's quite a sensitive topic, but one we believe should be addressed. Quite a number of people who adopt children just feel that they can take the children home and they live happily ever after. But that is not always the case. And I don't want to say that is never the case, because in some cases, you know how life happens. Everything goes on just the way you expect it to, but really, even children who are biological have issues. So we've decided to talk about this today because I meet a lot of people who've adopted children and have issues going on. And unfortunately, when people adopt in Nigeria, they don't go through proper counseling.
Hey,
but those who have been...
Hey.
Mrs. Adeshola. Mrs. Adeshola.
How are you?
Hello, Mrs. Adeshola. Okay, she's gone. Yeah, so a lot of the times in Nigeria, people are not given proper counseling when they adopt children. So they just stumble into parenting, and that could be rather challenging. For those who've been fortunate to adopt children from the Heritage Homes Orphanage, thanks to Mrs. Obasanya, who's on the platform, she put us on the right track right from the beginning. So we take you through thorough counseling and prepare you for adoption. Now, some of the topics we'll be dealing with today are loss, separation and grief, rejection and attachment disorders, reaction from late telling, and finding an identity. With a number of children who are adopted, you know, from the time when the child is taken away from the mother, there is loss. In other words, the child moves away from the mother and is taken by somebody else. There's a sense of loss which we tend to ignore. This separation, of course, has taken place, and sometimes the children are grieving. And another thing, of course, is rejection and finding it difficult to bond with their new families as they move along. And also finding an identity. Who am I? You know, when a child can't look at the mother or father and say, I look like my mom or look like my dad, that can present some issues. But I wouldn't go too deeply into things because we have three experts here who will be speaking to us about all of that today. I'll start by introducing to you Dr. Jibril Abdulmalik. He's a senior lecturer. Techno, please can you mute your mic? He's a senior lecturer and consultant psychiatrist with the Department of Psychiatry, College of Medicine, University of Ibadan. He's the founder of Asido Foundation for Mental Health Advocacy. He contributes a weekly column for the Nigerian Tribune on Thursdays titled Your Mental Health and You. We have also in the house Mrs. Chiadi Ndu, who was called to the bar in 1987. She has since obtained an MSc in psychology, certificates in addiction counseling, stress management, and diplomas in cognitive behavior therapy and depression management. She's currently working on her PhD. She's a member of the British Association of Behavioral Cognitive Psychotherapy and an affiliate of Life Assist, a South African-based employee well-being and health risk management firm. She's married with 3 children. We also have in the house, for those of you who were at the last meeting, Mrs. Bami Obasanya, who's a retired senior social worker specializing in adoption, fostering, and post-adoption work in the UK for over 30 years. Lots of experience there. She has worked directly with many children and young people affected by adoption and fostering, and she's currently the welfare executive of the Heritage Homes Orphanage. And lastly, I'm the host. My name is Mrs. Akenzua, Akenzua, and I am managing trustee at the Heritage Homes Orphanage since 2002. And I'd like to describe myself as an adoption advocate. So we'll go straight into the meeting now.
Sorry to interject, Emma. Could you be slightly louder, because it's quite the audio is not very audible. Could be from my side, I'm not sure.
Okay, is anyone else having challenges hearing me?
No, we can hear you.
We can hear you clearly.
Perhaps you could mute. We can hear you clearly. There are quite a few devices that aren't muted.
Yes.
So that's causing interruption.
We can hear you clearly.
Okay.
Please, can everybody mute themselves if you're not talking, please?
We would appreciate that very much. It would, then we can move swiftly with the meeting.
Okay, this person has been stuck since.
Sorry, can you all kindly mute your mics for us, please, so we can get into the meeting proper? There's Galaxy J7, I don't know, Effie, please, can you mute your mic, Techno?
Perhaps you could do mute all.
Unfortunately, I don't know how to do any of these things on Zoom. I would learn for next time, so I don't want to spoil the meeting altogether.
It's very...
So do bear with me.
Okay, it's very simple. Just go to participants, click participants.
Okay.
And below it will be mute all participants.
Okay, but when I need to, okay, I can see that, but when I need to unmute, what do I do?
Give me the
You'll
host
mute,
right
you'll mute the person in, you'll right click on the person's name and ask the person to unmute. Okay.
I'm just going to plead with everybody to just manage help me, just, what do you call it? Mute your mics, please. I would find that very distracting for now until I get really used to all of this Zoom thing. Okay, so Dr. Jibril, we'll start with you, please. Can we hear from you on generally what you have to say about the topics before we get into specifics? And you have 2 minutes, please, Doctor.
Thank you very much. Good evening.
I think we should mute it or unmute.
Oh, okay. Sorry. I'm going to, I think I'll just take your advice and do this mute thing.
Unmute. Okay.
Okay, so has that muted everybody?
No, it hasn't, if you can hear me.
Allow participants to unmute themselves. So I said no.
Right.
I think it's best for participants to mute when they need to speak, mute themselves, or I don't know.
Because we're really having disruptions with. Okay, I think I've muted everyone now. Have I?
No,
I don't think
no,
so,
you
because
haven't.
No, you haven't.
I'm sorry, it's just not working for me. Mute
are you
all.
using
Are you
using an iPad?
No, I'm using my laptop.
Okay.
This is Emewaje. Can you make me a co-host? Right click on my name and make me a co-host.
Okay, right click on your name.
Go to the chat. Click on the participants.
Yes.
So see, and then
it says more. Should I do more?
Yes, do more. Yes.
Okay, make host. Okay, I've got that. Okay, Amen.
All right.
Yes, you're host.
Awesome, it's done. It's done. I can say.
Okay, so I will unmute Emma. Sorry, Jibril, can you hear?
Yes, I can hear you.
Jibril? Okay,
yes,
are you ready? Emma?
Yes,
okay, I don't know whether Mrs. Akenzua will still wants to speak. I've muted her. I seem to have lost her. Let me just check if the host wants to.
Yes, I've unmuted myself. I'm good.
Okay, then so you can mute yourself when you finish talking, introducing Dr. Abdulmalik. So everybody else is muted.
Okay, Dr. Jibril, over to you, please. Uh-oh.
Okay. No, I'll handle anybody that comes up that needs to be muted.
Okay.
I'll mute you as well for that. You can unmute yourself.
Right. Thank you very much, Professor Emewaje, for stepping in. Right. And it's a pleasure to be here and participate in this very important discussion. Now, the starting point from that I want to approach this from is the concept of wounds generally. We are all very familiar with physical wounds. If you have a cut from when we were young in primary school and all of that, you know, your teachers or your parents or any adult there will help you clean the wound, apply iodine, put a bandage if necessary, and all of that. So, and the moment someone sees you and your leg has a bandage, you say, oh, you have an injury, sorry. So we are all very familiar and comfortable with the concept of physical wounds and physical injuries. However, psychological or emotional wounds, because they tend to be invisible, they are not as visible. There's no plaster, there's no bandage, right? You are not using crutches. So we tend to downplay it, overlook it, and not take cognizance of the fact that emotional or psychological wounds may be equally as traumatic or painful as physical injuries. So when we come to the issue of adoption and the impact on children, the impact on the adoptive families, on everybody, because it's a 360 degrees issue. Everybody, it has an impact on everybody. We need to understand that that impact is the impact of emotional or an invisible wound that is causing pain, emotional pain, trauma that needs to be understood, needs to be equally treated the same way we will treat a physical wound. So I would just like to say this as a foundational introductory concept before we continue. Thank you very much.
Thank you very much, Dr. Jibril. That was an excellent opening. It makes it very easy for the rest of us who are not doctors to understand what's going on. Mrs. Obasanya, would you kindly just give us an introduction into this before we go to Mrs. Ndu? Mrs. Obasanya.
Yes. Yes. Good evening, everyone. My own experience, obviously, is with children who suffer loss, separation, and grief. And we know from my experience and the children I've worked with over the years that irrespective of how and when and what happened to a child when they have to leave their own birth mother, there is a wound, like Dr. Jibril has said, which is there is a book called The Primal Wound, which actually talks about the fact that when we're born from a parent, initially, is written by Vera Furberg. If anyone is interested, it's a very interesting book that tells us about this invisible wound. That even when we're just born as a newborn baby, there is a wound of being separated from our birth mother, which causes some form of trauma to that baby. But the fact that from the womb, the baby can hear the mother's voice, can recognize the mother, it brings comfort for them. And then that wound is not something that festers. But when that child is separated and they're then moved into a new environment, it has a traumatic effect. And the child kind of starts to think, oh my God, what's happening? This is not the person I know, even though they cannot express that. So we know that separation causes loss, right? And if it's not well looked after at the beginning, it can lead to ongoing grief.
Thank you very much for that, Mrs. Obasanya. Mrs. Chiadi Ndu, can we hear from you, please? Mrs. Ndu?
Yeah, would you like to unmute me?
Yes, you're muted.
Oh, brilliant. Hello, everyone. It's such a pleasure and a privilege to be here. And this is something that my heart is very open to because of the kind of work I do. For me, what the most poignant thing is the feeling of rejection that the adoptee feels. The feeling of rejection. I read one of their statements. One of them wrote an article that I read, and she said, "How can someone's trash become someone's treasure?" That was so on point. She felt like trash. That was why her biological mother didn't want her. What she felt was rejection, and she was finding it difficult to reconcile. She, that her own mother didn't want. How can someone else want me? You know, she said put it so, how can someone's trash be another person's treasure? So what I always think about when I meet adoptees and when I'm counseling and having therapeutic sessions with them, I always say, you are special. You're not rejected. Someone was waiting for you. Rejection and acceptance is usually very, very, very deep for them. Thank you very much.
Thank you so much for that, Mrs. Ndu. You know, something I've found over the years in being in this adoption circle is the fact that a lot of people want to adopt babies, and simply for the fact that they feel they would have no recollection of their past whatsoever. So they say, no, I don't want an older child. I want a baby. Now, from what I can hear, Dr. Jibril, you now, is it really, I know Mrs. Obasanya has touched on that, but I want you to touch on it again. Is it really true that when a child is adopted at 0, taken from the mother at birth, that the child has no recollection of what's gone on?
It's absolutely not true, and I'm very grateful that Mrs. Obasanya had mentioned the concept of primal wound. What we now know is that even in the womb, the baby has a connection with the mother. The baby, in fact, studies have been done that show that the kind of diet that the mother takes during the pregnancy, when such children are adopted away, because we do some studies in psychiatry that we call adoption studies, right? Where we follow up children that were adopted from their biological parents and compare them. So in those type of studies where there was removal at birth, follow them up longitudinally, say 15 years later, and you ask them, what are your favorite foods, right? And it will, then the rate of concordance was so high, was higher than 70%. For instance, if this group of mothers were, their favorite food during pregnancy was jollof rice, right? And the other set of mothers was pounded yam. Just for example, it wasn't a Nigerian study, okay? Just to make it familiar. Follow them up down the line, and up to 70% of the children of, if you ask them what's your favorite food now, they were adopted. So remember, they didn't grow up in the same household with that biological mother. So, and up to 70% of them will say jollof rice if their mother was taking a lot of jollof rice during pregnancy, and pounded yam if that was the predominant. So things like music, the voice of the mother, even if the mother only held the baby once, babies are able to smell. Each and every one of us, we have a unique smell. I mean, not smell in a bad way, but the sweat glands on our skin, that the sweat pores, generates a unique smell, and that's what dogs that they use as sniff dogs, that's what they pick. They pick your scent. So let me not call it a smell, let me call it a scent. So they pick your scent, and then they can follow you. So babies, once they connect with their biological mother, even if it is once, and they pick up her scent, they can ascertain that it's different when it's someone else that's holding them or suckling them and so on. So we know for a fact, scientifically proven, that even when the child is removed immediately after, the baby is removed immediately after birth, they still have that sense of loss and grief, even though they may not be able to make sense of it or verbalize and all of that, but they feel it. And that is what we call the primal wound that Mrs. Obasanya mentioned earlier. Thank you.
Thank you so much. And this is not to scare anybody, even if a child is adopted or not. They're just issues in life generally. And I think what we seek to do in this meeting is just to open up your eyes a bit more, because some people go, oh, I've done everything for this child. I've done this, I've done that, yet the child is not satisfied. You know, it's just that the issues, and most people are not aware of these issues. And if you're not aware of the issues, you can't deal with them. You know, so Mrs. Obasanya, are there signs that indicate a child is going through, especially a baby I'm referring to now? With older children, it's a bit easier to see those signs, but are there signs with a baby for a mother to know that the child is going through grief?
Yes, in my experience, there are. And especially, I recollect several years ago when a little baby who was actually placed for adoption right straight from the hospital was placed at 4 months with an adoptive family. And she was so unsettled. She just cried all the time. The adoptive mother said, I can't put her down. I have to, even when I'm on the toilet, I have to be holding her. That she developed an injury from her arm for carrying this baby around, because no matter whatever she did, she could not console the baby. And the baby wasn't like that because he had gone to a foster carer before. And this is also part of what we'll come to talk about when we talked about attachment issues. But for that baby, the loss of the mother was significant in that even at the foster family, she was very unsettled. But there are some children who who don't experience that at all. They just sail through it, they accept it. And it's not that they haven't experienced the loss, but they manage it. So everyone is an individual and things affect them differently.
Yes, that's very important. That point is really important. And that's why we said challenges some adopted children face, you know, because not every child reacts in the same way. Like Auntie Bami said, you just find some kids have a way of coping. But having said so, Dr. Jibril, does it mean it's not there somewhere? Can it show up later?
So what will show up later?
Yes, I'm saying that a child who doesn't show any signs, or a baby who doesn't show signs of grieving or loss, can and just seems to be coping okay. Right. Can this show up later in their lives, like teenage years, whatever, if it's not dealt with properly?
Right, absolutely. You know, the thing is, children, all of us actually, right from childhood, our personalities are forming, right? So in children, we call it the temperament of the child. Some children are easygoing, they don't cry, they just smile all the time, they are pleasant and easygoing. Some other children are very cranky and irritable, and you know, you can't put them down, just like the example she. So depending on the temperament of the child and the personality which is beginning to form in childhood of the child, the way we handle things are different. Now, if it is not addressed, it may be that the child has coped very well by themselves and they may go through life well adjusted without complications. However, if it is that the child has just suppressed the problems, there is conflict beneath the surface, but the child has just learned to suppress it and not allow it surface, then in such a scenario, the conflict may still surface down the line, either during adolescence or even as late as when they are adults and they get married and they have their own children, and then their relationship with the children becomes difficult because of their own early unresolved issues about their childhood. So it's not, there's no mathematical formula for calculating how the course will go for each child, but I will advocate that it's best to have open conversations, deal with these issues, get an understanding of what the child thinks right? And how they are handling issues so that if they have difficulties, you help them resolve it so that they are better adjusted instead of just assuming that they are fine because they are not having difficulties at that stage. Thank you.
Thank you. I like something you said about open conversation, but I've just put that down somewhere. We'll come back to that. Mrs. Sundu, are these issues we're discussing now of loss, separation, and grief, are they peculiar to children who are adopted?
Well, quite frankly, when children are separated from their biological parents, something happens. Like the previous speakers have spoken, there's already an attachment. There's already a connection. And then you suddenly it stops. It's no longer available. It does shake a lot of children. And if it is not identified early and dealt with, I always say that things resurrect, things come back. I think that it must be, you can take it to the bank that there is a feeling of loss when most children are separated from their biological parents, their biological mother especially, because for 9 months there was a deep connection. Yeah.
Thank you.
There is a sense of loss.
Thank you very much. So, Dr. Jibril, would you say this sort of thing, the loss, separation, and grief, is peculiar to children who are adopted, or can any child go through separation, loss, and grief?
Absolutely, any child can go through, and I'll give a classic example. I had a colleague who is a medical doctor that works in the same hospital. She's female, and she had the opportunity to travel outside the country for a period of 1 year. It was a scholarship and funded, and she just had a baby that was like 5 months old then. And she was debating whether because if she goes there with the baby, she was going to the UK, she will need someone to help her babysit, and then the program she was supposed to go for is a clinical fellowship. So her mother, who also lives in Ibadan, felt, look, I would take the child, at least the child is old enough, I will take care of the child, you go for the program and all of that. And you know what happened? The first 2 months after the mother left for the UK, the baby was inconsolable, was crying, stopped eating, losing weight, was having episodes of diarrhea. The child was grieving the loss of the separation from her mother, even though it's for 1 year, and she's with her maternal grandmother, but despite the love, care, and affection, and she was definitely not adopted in this case, but that physical separation, the child felt it and experienced and displayed it, and everybody could see that this child was missing the biological mother. So any child that is separated, even whether it's for a short time or for a long time, from their biological mother can experience this loss and grief of separation.
Okay, I heard you mention some signs that a child could be grieving from separation, and diarrhea, crying, not eating. Are there any other signs that a mother somebody can see and know that this child is going through some loss and pain?
Okay, depending on the age of the child. So for instance, this baby I was describing was an infant. So for infants, you will have irritability, crying all the time, poor feeding. So the child was losing weight, was having all sorts of, so they were going to hospital all of the time, that the child is having diarrhea, because we call that sort of constellation, we call it failure to thrive, failure to thrive. So the child is not doing well, but there is no obvious physical problem, because if you do chest lab test and everything was normal, okay, but the child was not thriving because of emotional deprivation or neglect or separation or loss, as in the case of this child. So depending on the age of the child, if it's an infant, what I've described is what you will see. If it's a slightly older child, old enough to go to school, say primary school age child, you may have behavioral problems, bouts of aggressiveness, not complying with rules and regulations, being troublesome, getting into fights, generally been difficult to manage. And for teenagers, they may also act out, turn to drugs and other ways of showing because the particular problem for children is that they are not able to really verbalize and tell you,
Yeah.
oh, I'm uncomfortable with this, I'm not. So they tend to just act out. Another common symptom in a child who is in primary school, for instance, is that they may suddenly start bedwetting when previously they had been toilet trained. So those are some subtle signs that you get to indicate that they are going through emotional distress, they are not comfortable, and you may need to probe further to find out what exactly is going on. Thank you.
Mrs. Obasanya, thank you very much, Dr. Jibril, for that. Mrs. Obasanya, are there any experiences you've had with an older child who's grieving? And if so, what was it?
Just like Dr. Jibril has said, usually the older children are also displaying these things. They can become very clingy. When they become really kind of, they don't want to be separated from their adopter, like going to school in the morning becomes an issue when it's a school-age child, like between 5 and even up to age of 10, 11. It's saying, I don't want to go, because really in their subconscious, they believe that if this one leaves as well, my other parent has left, maybe this one too, she's on her brink, because it makes a dent in their psyche, the experience of the loss they've suffered, and like the brain does, it prepares you for the future of what could happen. So the same thing doesn't repeat itself. So the children become quite clingy. So you find children who don't want to go and play with other children. Mommy, give me another kiss, give me another cuddle. Mommy, I don't want to go. Why don't you come with me? And you say, I can't come to school with you. But they do that. And when they're teenagers, they can be very withdrawn. They can show by being withdrawn, in that they would want to be on their own. They don't make very friends. They say they don't like other people. They want to do things on their own. They don't want to talk. They don't want to engage with family and other adults, because they don't want to talk about this feeling that makes them feel very uncomfortable.
Okay. Thank you very much for that. Now, are there any practical solutions that, doctor, that you can offer to help parents on this platform deal with some of these issues? What do they do practically? So you have a child showing all of these symptoms, and you don't know what to do. Typically in Nigeria, we start beating the child, this stubborn child, what's wrong with this child? And the problem doesn't get solved, it only gets worse. So what can we do if we have these problems?
Right. The first thing is to have open conversations with your child. Very important that you carry them along, let them understand what exactly is going on, the fact that they've been adopted and all that. Be open with them, because usually the first traumatic shock to these children is where they have to discover from a third party. Maybe someone was teasing them in school or bullying them, to you that somebody just bought you, or somebody, they just went and carried you. It's not your mother. That's maybe, and usually, typically in Nigeria, if they then come home and ask their parents, they'll deny. Who told you that? Nonsense. The typical response is to be denied. But the children, once that seed of doubt has been sown, right, they will then begin to put 2 and 2 together. And if they eventually find out by themselves that they were truly adopted, that trust is destroyed. And if they can't trust you, they will withdraw. So please be open and honest with them, so that let them hear from you first rather than from a third party, because a third party may break that information in a malicious manner that is aimed to maximally hurt their feelings. In which case you are now, trying to, repair, close the barn after the horses have bolted. Okay, so it's best to have open conversations, be honest with the child, be the one to break the information and let them know from the get-go, number one. The second thing we should do is love this child unconditionally. Love them, show them affection, right? It's going to be difficult. I mean, nobody says it's a walk in the park and oh, they lived happily ever after. But even when you have your biological child, it's still, problematic. There are difficult phases and so on. So, but you just need to, if you have taken the decision to be an adoptive parent, you need to go the whole length. Don't adopt a child and then you start having buyer's remorse a month afterwards or a year afterwards, and then you are half in, half out. You are not committed. Let them know that you accept them the way they are, you love them, and they don't have, because they are dealing with a lot of insecurity and sense of their position in the scheme of things. So you need to show them love, show them affection. You also need to be patient. That this process, there are going to be difficulties, difficult phases. You need a lot of patience. And if you do all of these basic things and there are still difficulties, then you may need to see a professional, mental health professional, a child psychologist or a child psychiatrist, who can see the family as well as the child, and then may advise if there are problems or difficulties that require specific interventions or not. So that would be my recommendation. Thank you.
Thank you very much. Mrs. Undu, are you there?
Yes, I am.
Okay. What would you say to a mother or father who's listening to this and is really getting scared and say, oh my goodness, is this what adoption is about? I'm scared. I don't think I'm going to go into this. What would you say to such a person?
To be very honest, like most things in life, it's not a walk in the park. Being an adoptive parent is not easy, just like being a biological parent is not easy. I mean, it's just that it's peculiar. And the peculiarity is that this child has to be assured that I love you. I want you. I accept you. It's okay. You can be you with me. You're safe with me. You can trust me. I have your back. I promise you, if one is able to communicate this to the child, that child will blossom. That is what every child needs. An environment that says to you, you are welcome, you are loved, you are accepted. It's okay to be you. I'll do anything for you. That is what every child wants, whether the child is adopted or biological. That is the language children understand. And if you're able to communicate that effectively to the child, I am sure that it will work out and the child will be fine. It's nothing to panic about. Yeah.
I like something. Yes, thank you very much, Mrs. Undu. I like something you said. It's okay to be you. A lot of children who are adopted feel they have to live up to a certain standard. And indeed, the standards are high that most parents expect from a child who's adopted. They almost, and Mrs. Obasanya, this is you now, they almost expect perfection from this child. I've adopted this child. You've waited some 20, 30 years to have a child, 15 years, whatever. And now you have this child, and perhaps that's going to be the only child you have. So you have all of these great expectations lumped on that child. The child should be academically this, and the child must be that. And, unrealistic, to be honest, expectations. Isn't that such a weight for a child to carry, Auntie Bami?
Yes, such a big weight. Because I used to visit children, families who've just adopted. And after a while, I started to think that adopted children are expected to perform. they're kind of like circus clowns in that, oh, come and show Bami your new toy. Come and show the new dress we've just bought her. We've just bought her this and that. We've just come from holiday. Do you want to see the things we bought from holiday? And the little boy and the little girl is running in and out, showing you this, showing you that, doing all those things. Whereas if I go to visit a biological child in their family, whether things are going good or not, they didn't have to perform. And it kind of dawned on me that when they're an adopted child, the expectation for them to prove to other people that they are good, worthy parents is also putting pressure on the child to not be able to be themselves. So they can't come in and say, how are you? What are you doing? The mother is already apologizing. Don't say that. Don't you know? Didn't I told you already that the social worker is coming, this and that and the other. Whereas, what I'm trying to say is that all the time the child is on show. So it's very, very important that as an adopter, you know that the information and the things they have to do, the expectation, you do not put any more than is necessary on the child, and just let them be there. Let them just be a child and do what they want to do. And then the social worker is well able, or the people involved are well able to make their own assessment whether things are going or not. So if I want to know, I remembered, for instance, we went to see a little boy that was adopted through the heritage homes. It was Emmy and I. And on the day we went there, I don't know if Emmy remembered, the mothers kept saying, oh, we went to Balogun yesterday. We bought this new train. We bought this thing. Go and bring all your toys. Go and bring all your toys. And the child ran and brought all the toys. And she says, we bought some shoes, bought 5 pairs of shoes. So the little boy went and brought all the shoes. And I said, that's really good. I'm really convinced that you're not going to go to school with no shoes on. You have plenty of shoes here, I said. But that was for the benefit of the mother, that, obviously this is your child. You need to learn to actually just accept the child for who they are.
Okay, that's thank you so much for that. And just in line with that, I know that a lot of people would say concerning a child who's adopted that I've done everything, I rescued this child. There's that mentality of I rescued the child, and so everything I do, the child should be happy with. And if the child is not, there's a tendency to say that the child is ungrateful, and you deal with the child from that angle. Dr. Malik, can you just speak to that a bit?
Right. Thank you very much. That's a very important aspect that you just raised. The aspect where we feel that, we are coming from our high pedestal to come and do a favor to a child that is disadvantaged and is not wanted and all of that. And so you are so lucky that we chose you, right? And then you should live happily ever after, that we've done you a favor. We should be clear that when there is adoption is fulfilling a need for every party involved, right? But there's this glamorization where, you have famous celebrities come to Africa to adopt a child, and it makes it look like you're the savior that has, the angel that has come down to. So that is something that may creep in, even with the best of intentions, unconsciously, that, I've done a lot for this child, I've rescued this child. But that child has also come into your life to fill a void, right? Either because you do not have biological children, or you want to have more and show them love and help them as your contribution to society. But what we usually say in psychology is that when you are altruistic, when you do someone a favor, in quotes, you're actually doing yourself a favor, because your brain rewards you by releasing some chemicals that make you feel good about yourself and improves your emotional mood, your well-being, and all of that. So it's actually self satisfying when you think you are doing something nice to others, your body, your brain rewards you too for doing it. So in a way, you are also getting some benefit. The child is getting, so it's like a transactional relationship that should be a win-win where all parties are committed to that understanding, not one party is thinking, oh, I'm buying you all these fine clothes, I'm buying you so many shoes, you should be grateful, you should be the perfect child. It shouldn't be that approach. And the other thing is that when you child that we chose you, I chose you, you are so lucky because we chose you. It also, you should appreciate that in the child perspective, the child is also going to have some questions. Oh, if I'm so special that you
Sorry,
chose
one
me.
second. Prof, can you help me? Can you help me mute Infinix Note 7? Infinix Note 7. Okay. Yes, please go on, doctor.
Thank you. I'll just just to make the final comment that, you know, if you tell the child that, oh, you are so special, I chose you, you are favored because I really wanted you. That also, the flip side of that coin is, okay, if I'm so special that you chose me, how come my biological parents felt that I was so useless that they abandoned me? So in every scenario, there are unanswered questions, and it's only when you have open communication channels that these things can be allowed to come up, and you can address them openly and redress and reassure the child and help them be confident and reassured about their position in your life, within the family, and within the general scheme of things in life generally. Thank you.
Thank you. Doctor, I hear you when you say open conversations. Very important for us to do so, but very difficult for most people. How do they start? Auntie Bami, how do you start this conversation? Because it's very delicate. A child is adopted. I try and put myself in the position of the child. You've been taken away from this environment. And we have to remember that in most cases, children who have been taken from their biological parents do not go from biological family straight to adoptive family. Sometimes they go through a police station into an orphanage before they get home finally. So all of this trauma, all of these things have happened. And the child could be quite traumatized when they get to you. Now, Auntie Bami, it's a difficult conversation for anyone to start. Where do you start from?
Oh, well, you start at the very beginning, like we talked about last time, which is at the beginning of once the child comes into your home, you leave the child enough time to settle. It's not like a conversation you start having in a month or two, or even I even say 6, depends on how old the child is. If the child is not likely to have a memory of being placed, just give them time to settle. They start to call you mommy. They start to understand the work. So you don't actually re-traumatize them by bringing in something that's giving them more confusion. So, but once they are settled, I'll say at least within 6 months, from about 6 months, and you can now say that everybody is happy, he's settled, he's got his grandparents or anybody around him or siblings, then you can introduce the conversation. But just like we talked about last week, the earlier you do, the better. Because when the children are very young, you're practicing on them. This is what I say. You're practicing on your child by telling a pre-verbal child that you have 2 mommies, you can't, you have another mommy, you have a tummy mommy, you have this, you have that. The child doesn't understand any of those things. But by the time they're 3 or 4, they start using that language back to you. And then you can ask them, do you understand what it means to be adopted? And then they will say no, usually. And then you explain to them. And then you say, you are adopted. And then they be quiet and say, okay, what does that mean? If the child is told at that age, they're likely to say, I'm adopted. Yeah, I am. And they don't really understand about it, or they might repeat what you've said to other people. But the quicker you have the conversation, you are practicing your confidence to be able to say it. Until one day, from a shock, the child will just come and say, "Mommy, you know I'm adopted. What does adoption mean?" And then you know it's sunk in, and then you start doing the work as is necessary. So, like we've always said, and I've always believed, the earlier you do it, the better. So if you do it from us, if the child comes to you at 6 months, by the time it's a year, you're using the word every day. And in Nigeria's context, I think it's also important that we embrace, some of the nuances that is peculiar to where our children come from, which I don't think we do very much. Even which means that if let's say I know in some cases you don't, but in cases that your biological child is a Yoruba child, for instance, and you are from Edo, and you don't know much anymore than what you see every day about Yoruba culture, you know that about your child. So you will encourage that in everything that when you are telling your child, you'll be saying things like, you are from the Yoruba tribe. This is what they do, this and that and the other, and their weddings are like this. They be different from how we do it. So if this and that, like you bring it into it, so the child has a sense, because where you're going is about their identity as they get older. It's part of their identity. If you people are separated completely from what you use to identify them, it makes them feel lost. So it's a big task, I'll say, but it's something that you need to think beforehand and do it appropriately.
Thank you very much. I think we'll just move on. Thank you, Auntie Bami. We'll move on to talk a bit about rejection. Time is fast spent already. Rejection and attachment disorders. Mrs. Ndu, I know that's an area you like very much and done quite a bit of work on. So what I want to ask now is, I hear some parents say, no matter how much love I show this child, the child still feels rejected. What do I do?
The truth is that to be adopted is not an easy place to be. The truth is it's the feeling of the mother that you were connected with. You were a fetus, you were in her womb, you were a part of her, and then she gives you up. Your default mode is, who else can I trust? Where else is safe? How can I open up to another person? What if the person doesn't want me? What if the person changes their mind? What if, so the critical thing, the reason it's important for you to go ahead and explain to the child that, in fact, the story I always I tell parents to tell is, listen, life knew that I needed you. Life knew that you were important to me. That's why it arranged for you to come the way you came. Your mom, I don't know why your biological mom didn't want you, but it was clearly because I wanted you that you came to me. You must emphasize how important she is to you. You must emphasize how safe she is with you. You must emphasize how it's okay. I accept you. I love you. I know that you want your mom. It's okay for you to want your mom. It's all right. But it doesn't compromise how I feel about you. I love you so, so much. It's crucial for you to let the child know that you can't, a life without her, would be, it's so, you must regenerate her sense of self-worth, because that is what is usually compromised when they find out they've been given up for adoption. And what they need to know is, am I safe with you? Would you give me up one day? Is it okay to be your child? Do you really, really love me? Am I really lovable? My mommy didn't love me. She let me go. What if you do the same? It is a very delicate thing. And, you know, I know that it is, even full-grown adults are uncomfortable with rejection. When you go to work in a new place, it's important to you that you're accepted. When you even go to a new church, it's important to you that you're accepted. So you can imagine what it is like for a little tiny baby. You must explain to her that it's not that I needed you. That's why you came into my life. It is safe to be here. It is safe to be here. I love you and come and be with me. This is so critical and crucial. And you must emphasize this so that the pain of the loss will dwindle. Yeah?
Thank you so much. So what I hear you say is it's a continuous thing. You have to keep reaffirming this child over and over. Don't get impatient. Don't get tired. It happens with biological children too, who've suffered some issue here or there, and you need to keep reassuring them of your love. So to every mother, father out there listening to me, it's that continuous, I love you very much. Make them feel safe, make them feel wanted in every way that you can. Now, Dr. Jibril, how do we begin to address this issue of, apart from what Mrs. Ndu has said about the love talk, is there anything else we can do to make a child feel accepted? Hello, Doc.
Hello, sorry.
Can everyone hear me? Okay, doctor. I said, apart from what Mrs. Ndu said about the love talk, reassuring the child about being loved, is there any other thing we need to do for a child who's feeling rejected?
Right. I will keep emphasizing this, and I can't emphasize it enough. The essence of communication is a two-way traffic. Communication is not you talking to the child alone. It's also you listening to the child and trying to understand what's going on in the mind of the understanding of the child. So what's the child's understanding of the situation? It's very important that we have this communication. So it's a bi-directional communication, information flow. So listen to the child. Find out what are the concerns, what are the questions of the child, and try to address them. Don't feel that, oh, I know what the child, my son or my daughter, I know what he or she wants to know, and I'm going to just tell you and just reassure you. No, make it a conversation. Listen to the child. Let the child talk to you in his or her own words. What are his or her fears, concerns, anxieties, and all of that, and ask them, how do you feel? Do you feel comfortable in our home? Do you feel comfortable in your school? So if you've been having this conversation, it's not going to be like, oh, it's one day you just say, come, we have to talk today. It should be something that should be routine. It's part of your routine that you are having conversations, you are asking about school, you're asking about her feelings, her emotions, or his, as the case may be. But I just want to quickly add a caveat. Let us not go away from here thinking, oh, I've adopted a child, I'm in trouble. It's a Herculean task. I don't know how I'm going to solve it. No, that is contrary to what we want to achieve at the end of this conversation. It's the same way with having, some people are terrified about becoming mothers when they are pregnant for the first time. Am I going to be a good mother? Am I going to be a bad mother? Am I going to be a good parent? How will I do this? And so on. So these are natural, but the most important ingredient for success is to have a good heart and to love the child and to be willing to do the best for the child. Those are the most important ingredients. No, there's no formula for parenting, whether it's your biological child or it's an adopted child. It's to have good intentions and being willing to go the extra mile to do the best you can for that child. Thank you.
Thank you very much. And from what Dr. Jibril has said, I also think it's important for parents to be very comfortable first and foremost with themselves and the adoption, because if you're not comfortable with having adopted a child, you're still going through your own pain of not having a child biologically. It would project when you're dealing with your child. That's probably why it would be difficult to start a conversation, because it opens up your wounds again. So it's absolutely important for you to deal with those wounds. Don't just pretend it's not there. Don't just cover the wound up. It is wounding, especially in our society, where people are so unforgiving of women who don't have children. They literally punish them, as society does. So one can understand that feeling of not wanting to open up that wound again. And that also explains why a lot of people don't even want to talk about their adoption. They just want to pick up their child and pretend it never happened. But, you know, like we said over and over, it will come up at some stage, and most likely in a way you don't want it to come out, you know. So that's the reason why we say tell early, and have an ongoing conversation with your child like you would do with your biological child anyway. There are always things you're dealing with. There are always things you're trying to get your child to understand, and also listening. He says, listen. You know, we are not so good at listening on this side of the world. We want to talk at children. And, you know, when we were growing up, we used to hear them say children are not supposed to be heard. They are supposed to be seen, or something like that. You know, so I think quite a few of us still do that. So please just try and listen. I want to talk now, Mrs. Obasanya, this issue of attachment disorder is something that is really, really crucial in adoption. I know usually when someone comes to adopt a child from the Heritage Homes Orphanage, we would say to you, take maternity leave, no matter how old the child is. Take off 3 months to be with that child on your own. And we also say to parents, do not hand the child over to a nanny when you adopt the child, because typically what happens is, like I've said earlier, the child has moved from biological mother, probably gone to a police station, from there to an orphanage, and then eventually to your home. So several hands. So when the child comes to you, you're just another hand in the child's mind. They haven't got any sense of permanency yet, you know. So Auntie Bami, how do we make a child who's been adopted, how do we create that bond with the child?
Very important. Like from the very beginning, once the child, like we do in the heritage homes, once the child is matched with the adopter, we expect the adopter to come in every day, just to sit around, not to do anything initially, just to come in, sit in the room. The child is not, he might just be playing around the adopter, and the adopter is watching, asking how, when it's feeding time, she's fed, and then maybe after 2 or 3 days, we encourage the adopter to actually help feed the children. So the transition from living in an orphanage to going into one family has to be a slow one that is managed very well. So we do have a planning meeting where we look at children from going from being in an orphanage to a family could take anything up to 3-4 weeks before they actually are moved. And a lot of that, we do it just slowly. Once we know that the child is in, then we encourage the child to go with their favorite nanny to go and visit the home and have, you know, some dinner or lunch. And then they come back, then they go and spend the whole day. And then they go, depending on the age of the child, they might even stay for a weekend. And then eventually they move in. So the transition is slow. The child gets to understand that this is going to be my new family. At the same time, we ask the adopters to make a little book, like an album, to their home, where the child's bedroom is going to be, and stuff like that, so that the child too can keep that with them, and the picture of the parents, so that the child, the transition is very important. When it comes to attachment, the reason it's very important, just like Emma said, children go through different, stages in their lives where they've been let down by adults. that have been around them. They've been probably abandoned by their mother, found in a gutter somewhere. Some of them have been left in a marketplace or not, or some of them have been taken to the orphanage by the birth mother. Whatever, the child still feels abandoned, whether it's done really, really badly or it's done really well. The feeling for the child is the same as they grow older. So the problem they have with the attachment is that, oh, another person, another person. This one is now going to say, I'm your mom, I'll be here forever. That's what the last one said. And the last one said, when children have had multiple breakages and multiple disappointments by adults have let them down so much that they have learned not to trust adults. So they don't trust people and they don't take them for their word. So they don't, and they, I've seen cases where the children do everything to break down the placement just to fulfill that feeling that adults are not trustworthy. So they start to react in that way. They go into a home like a 5 or 6-year-old will start to do naughty things, not behaving at school, not listening to mom, not doing anything, because they're so suffering from this feeling of, I'm not lovable, I should be rejected. So let me just do things and break down this placement fast, so I can go back to what I know. These people, they are not trustworthy. I prefer to be in an orphanage where, at least it's not just me. So those feelings are very strong in children, and it is hard for adopters who are trying their best to try and bring these children into their families. But irrespective, it depends very much on their experiences. So the more broken attachments they have, the more difficult it gets for them to reattach. So going from the mother to the police station and to an orphanage is not too bad in some cases, because in the UK, I've worked with children who've had 17 placements. 17 placements. Who do you trust? So they don't care anymore. You say, oh, you are living here. Okay. And if that person is trying their best, they do their best to make sure they break it down. So in Nigeria, we are lucky that if the children are consistent and the carers are consistent and very little change, the better for the children.
Oh, thank you so much for that. Mrs. Sundu, Mrs. Sundu, are you there?
Yes, ma'am, I'm right here.
Okay, what can you add to this for us, please?
Which one in particular?
Okay, on rejection and attachment. Rejection and attachment.
They have
cope with this? How do we move forward? How do we help a mother who's listening and wants to know how best she can bond with her child and make her child feel totally accepted?
To be very honest with you, what my take always is acceptance. When I say acceptance, I mean accepting the child and communicating to the child, it's okay. I am not judging you. I'm not upset that you're feeling the way you're feeling. I'm not upset that you're wanting your birth mom. I'm not upset. I accept how you feel. It's okay to feel the way you feel. It's normal. It's natural. Dr. Jibril said it so perfectly when he said, listen, learning how to listen. And this is the take home for every person. Listen, know exactly what the child is trying to say. When I say to people, communicate, when I say communication, it's not really what people say communication is. For me, communication is what the other person is hearing. What is that child hearing? How does he interpret or she interpret what you're saying? Does the child understand what a hug means? Does the child, some children have never been hugged. You're hugging them and they're looking at you like, what's that? That's so strange. So what language does the child understand? What does the child consider affection? You must find out those details because of individual differences. Each child is different. What works for Tom may not work for Tim. So you must learn what the child hears. How does he hear it? Why does he hear it? Who is this child? What is this child really afraid of? What does this child worry about? Is my opinion so important to him? Why is it so important to him? It is critical that we understand the child's why. We must get into their space. These are the things that's going to help them to relax, let their guards down, and begin to blossom and be the real people that they are because of the safety that we have created in the place. I emphasize again, communicate effectively. Be aware of what the child is hearing and accept the child. Accept the child. Accept the child. Accept their weaknesses, accept their fears. That is their reality. When you accept it, then you help him walk through it eventually. But critically, initially, you must accept the child. Thank you.
Thank you very much. And Dr. Malik, I'm just going to move on now to finding an identity. I know the issue of finding an identity is a very serious one with any child, really, especially when they become teenagers. But how much more a child who's been adopted knows he's adopted or she's adopted and doesn't know who their biological parents are. And in some cases, you find a friend of mine said he was much taller than everyone in his family. I think the rest of them were from shoulders down. There was no one so tall in his family. And, you know, so you're wondering, who am I? Especially where the adoptive parents cannot offer any information. In Nigeria, information is very scanty, you know, when children are adopted. It's most orphanages don't keep anything because they just want to do away. I mean, even the ministry used to say to women in those days, pad your tummy, move from where you were living before, and just blot out your life before this adoption, basically. So in such a situation, there's no information, you know. So how does this child begin to find an identity? What would you say to the parents? Because lots of questions will come up.
Right. Thank you very much. For the parents, it's identity challenges is a common phase of development for all adolescents, whether they are living with biological parents or adoptive parents. It's a phase of development because if you look at life course, as a child, your parents will give you a haircut. They determine when you have a haircut, what you wear, what you eat, when you eat. Then you get to primary school, they still control all of that. By the time you get to secondary school, you hit teenage, adolescence, you begin to want to assert yourself. I don't want this haircut. I want to keep an afro. I don't like this. Don't buy clothes for me. Take me there. Let me select what I want to wear and all of that. So they are beginning to want to assert their independence at that time. Now, if such a child or adolescent at that time also was adopted and you don't have information, even where there is the potential to get information, I would recommend, it's my personal recommendation, that you tell them that they should wait until they are 18, right? So that they are mature to some extent and can follow through legally, even if they want to check for information, because it can be very disruptive when the child is not yet mature cognitively in terms of their thinking and emotions. Like a child that's 10 and says, oh, I want to know my father, I want to know my mother, and I start crying and throwing a tantrum. It's more difficult for them to deal with that.
Sorry, Celine, please, can you help us mute your mic? Or Professor Waje, please, can you help us mute Celine's mic? Thank you. Prof, are you there? Celine's mic. Okay, yeah, done.
Thank you very much. So it's important to appreciate that these challenges are not strange or out of the question. And when they do come, discuss with them and let them know that, look, for now, we don't have information, or when you are 18 and you are legally an adult, we will explore this opportunities. It's also very important that parents, adoptive parents, don't feel like they are being betrayed because the child they adopted and looked after all these years is asking questions about the biological parent. Don't feel betrayed. Don't take it like it's natural curiosity and a sense of wanting to know, do I have siblings? What do they look like? What kind of people? What were the circumstances? Why did they put me up for abandonment? And sometimes, especially when they are still children, before they hit adolescence, they may still have some fantasy, magical thinking that one day my mother, biological mother, will come and say, oh, I'm so sorry, it was all a big misunderstanding and they love me. Because accepting that maybe they put me up for adoption because they didn't love me, there are lots of uncertainty, insecurity that they have, curiosity. What led to this decision? How come they put me up and all of that? So you should understand and have empathy that these are natural questions that will agitate the mind of anyone, and try to reassure them and let them know that you are going to have a good life, and I'll do all that is in my power to assist, support, love, care for you, and everything is going to go smoothly to the best of your ability, because none of us can actually predict what will happen tomorrow, even to ourselves, right? So you give reassurances, but put the caveat that to the best of your ability, you are going to do this. So that will be my recommendation. Thanks.
Thank you very much. Mrs. Ndu, can we just have your closing remarks before we go into, time is fast spent, before we take a few questions from the chat room. Mrs. Ndu, are you there?
Yes, I am.
Just your closing remarks. Thank you.
You see, the truth is, it is normal for an adoptee to want to know who their parents are. They want to know, who am I? Where do I belong? Why didn't want my parents? It's natural. It has nothing. It's not an indication of how they feel about you. It's not an indication of their acceptance of your love. It's not an indication. It is a natural curiosity. Everybody wants to know what their origin is, and you must respect that. And when it comes to that place, the best you can do, because you're now their actual parent, is to support them and guide them in the particular way that they should go to make it easier for them. It is not, it's not, they're not saying that you haven't been a good parent. They're not saying that we don't like being your child. They are just saying, I want to know, who am I? Who am I? Who is my mother? Do I have siblings? Do they look like me? Are they tall? It is natural curiosity. It is not an indication of your capacity and your effect and your importance in their lives. And you must see it like that and help them navigate that place. That's really what I want to end with. Thank you so much for this opportunity.
Don't run away. We will have questions in case you need to answer.
Okay. All right.
Yeah, so just taking on from what she said, that it's just natural for people to want to know. But I hear somebody say, if we never told, we wouldn't be dealing with all of these things. Please listen to the other seminar we had on should we tell a child they're adopted or not. And we came to the conclusion that you should tell the child, and as soon as the child gets to begin to pass that information on, because like Dr. Jibril said, somebody else might tell and tell in the wrong way. So perhaps you need to listen to that recording. Mrs. Obasanya, your closing remarks, please.
Well, when it comes to identity, it's quite crucial, just like the other two speakers have said. It's very important because your identity, it's like a God-given right that you have to be able to identify yourself, and you need all the tools to do that. When you have all the information about your birth family, you can say, my grandfather was this, my sister was that. And if you don't even know, you can go and ask them. But when you are adopted, that is not an option you have. You don't have those information. And so your adopters have very little they can do, even no matter how supportive they are, to be able to help you to navigate this world where you feel like you don't look like anybody, or where you are now doubting whether your parents really love you or not. And in my experience, I know working with post-adoption people, we know a lot of them carry a lot of baggage to do with their identity, to the extent that they wouldn't even be able to tell their adopters that they want to search for their birth families. And a lot of them wait until their adopters have passed away before they will actually go and investigate and find their birth families. And they say, oh, I couldn't really do that because I think my mom would be devastated to find out that I want to know about this. But people are coming forward in their 60s and 70s trying to find their families, because it just completes them. It's like a jigsaw puzzle with a few pieces missing. And it's no good to anybody when you haven't got the true picture. So adoption it's quite crucial for the parent, just like my other colleagues have said, to actually accept the child. You have to accept the child in totality, is what I usually say. I say you accept your child in totality. So all their baggages, all the things that are not right or wrong, doesn't matter. It's still your child. So what you find out, it didn't matter. It's still your child. But those information will actually become significant to those adoptees as they get older and they are looking for their place in the world.
Thank you very much, Auntie Bami, for that. And Dr. Jibril, your closing remarks, please.
Right, thank you very much. Just to reassure everybody in the audience here that adopting a child, bringing up a child is in many ways just like having your biological child. Many of these children with love, openness, and affection will do well. The vast majority will do well without significant problems, right? It's just the minority that may have problems, difficulties coping, adjusting, and all of that. And even in those instances, with the right mindset and professional support, these issues can be resolved and everybody will then move on successfully. So when we are highlighting the challenges, it is just to ensure that you are sensitized and aware that these things may crop up. It's not that that is the norm for every child that is adopted or for every family that adopts a child. No. So that will be my closing comments, to reassure us to be optimistic and not be scared of doing what is actually very right and very useful for all parties involved.
Thank you. So, are you done, Doctor?
Thank you.
Thank you so very much. You took those words out of my mouth, Dr. Jibril. I will just again re-emphasize some of the things he has said. Yes, that, it's not, don't get scared and think, I wish I didn't have to go through this. Honestly, trust me, you go through all of these things, literally everything you can go through with a biological child. So do not be discouraged. We haven't set this up to discourage you. We've set this up to make sure that your adoption goes well. You're aware of the issues that could come up and you deal with them properly. And like we all do with our biological children, open, honest conversations, please. It's when you're hiding, when you're trying to cover one lie with another, that's when things become really complicated. It can really be a very happy setup. And I have seen many adoptions that have worked successfully. And I have also seen adoptions that have gone quite wrong. So that's the reason why we're trying to make sure that you know what you need to know. And that if you see any signs of any of these things we have mentioned, you can deal with them up front. I would want to take a few questions before we finish up here. Someone says here that do we also see these signs of separation when children are separated, I believe she meant, instead of selected, separated from their fathers? Mrs. Obasanya, does this also happen when children are separated from their fathers?
Well, any
grief, loss?
Yes, you could, depending on how what kind of separation it is. If the father has never been a permanent feature in the child's life, it is less traumatic. So if a child is aware that Mr. John is my dad, he lives down the road, I see him once or twice a year at Christmas, the child grows up accepting that, but it doesn't really have a relationship. But the more relationship a child has with an individual, which will be like, say, when a child is living in an orphanage for 4 years before they are adopted, or if they are they went in the orphanage when they were 6 months and they didn't get adopted until they're 6. That's a significant relationship that they have made with those people. So the same thing, if the father was a feature in the child's life before the parents separated, for instance, then it will need working at, and the child to have constant contact with that person if they are important to them. So we mustn't underplay that because the child is not adopted doesn't mean separation doesn't affect them. They still grieve the same way.
Thank you very much. Then someone else says here, my son is now 16. I don't even know how to begin to tell him. He came to us the day he was born. What do I do? I would say to that person, please leave your contact details and I can talk to you or have Mrs. Obasanya talk to you about what to do. And also you can watch the video that we did on telling. It's quite instructive, and the one we did last week on how and when to tell. It's on YouTube, Joy of Adoption on YouTube. That's why we do this seminar, so that people can go and get information there, even if they can't get in touch with us. Okay? Box your question. It's not a simple question. Someone else says, what if we have no records whatsoever of the birth mother? Is it okay to say that she's dead? Okay, Mrs. Obasanya.
No, it's not okay. It's not okay to say it's dead. I think you should just say what you know. To say to a child, we don't have the information, but what we have is the name of the orphanage where we got you from. Let's go and visit. Let's go and see what's there, even though there might not be any information that you are aware of. But seeing the place and maybe 1 or 2 people that used to know him or her at the time is the best you can do. I don't know your mother's whereabouts is the truth. And actually saying the mother is dead is not true. And we shouldn't do that.
Yes, because, if for any reason you get to find out information about the mother, you've lost credibility with your child. Yes, the truth is always the truth, and it sets everybody free. The moment you get some information or somebody has some information and the child happens to find out, so what happens? You begin to now try and cover up that with another lie, and it gets all messy. Tell the truth always, and the truth is hard sometimes, but it sets everybody free at the end of the day. So I broke the news to her when she was 8 years. She was horrified. Someone says I didn't tell, I adopted my daughter when she was about a month old. My greatest fear was her finding out from anyone else but me. So I broke the news to her when she was 8 years old. She was horrified, but I comforted her. She was totally confident of my love and commitment to her, and she settled down. She's 15 now and doing well. Fantastic story. Thank you very much for that. I've told my son, but he didn't believe me. how else can I make him believe me? That's the nice one. Because obviously the child feels so loved and, wouldn't believe. Mrs. Obasanya or Dr. Jibril, yes, I think that's worth clapping. Doesn't even believe his mom.
Or Emma.
Yes?
It could actually be denial.
Well, true. It could be, yes, that's why you're here. Okay, tell us.
It could actually be denial, because that's how some people cope with grief.
Yes.
Grief, yeah. It could be so painful.
So what does she do in that situation?
Find out what it is exactly, whether it is really that he's very happy and he's so confident or find out whether he's in denial. She is the only person that has the capacity to find that out. And if it is denial, she must work on it, because it's a phase of grieving. It's a stage in grieving. People go through denial. Is one of the ways people grieve, actually. It's one of the steps. So she must identify what it really is. Is he really so happy and so loved, or is he so grieved that he can't accept the truth and he shuts it down? That can be dangerous, because he's going to be waiting for him. Okay?
Okay. Thank you for that perspective.
I communicated that, right?
Yes. Oh, yes, certainly. I think we got that. Certainly. Dr. Jibril, anything to say to that?
No, she's absolutely right, and I align with her. Thank you.
Okay, thank you. Okay, if we can move on now. Yes, just bear with me while I navigate through this. If I haven't taken your questions, you can actually ask if you have any questions while I'm going through this to sieve through. If anyone's got a question, please indicate by raising your hand and you'll be unmuted. Okay, somebody else says here, it's very difficult for a single mother to disclose because the children keep asking for their father. How do they go about it? In other words, what do you say, Auntie Bami, when you're a single adopter and mother, and the child is saying, where's my father? What do you say to that child?
You tell the child that they're adopted and you are a single adopter. That is the truth. So you will say, I'm not aware of your birth origins because we adopted you from an orphanage. I adopted you from an orphanage as a single mother, and we are not aware of your birth father. The whole thing is based on telling the child the truth, telling it there's no need to cover it up or to find another way of making it better, because you're not making it better and you can't make it better. You can't make it better. The role of any parent is that you want to soothe your child's pain and make it better. But you don't do that. Once the child asks the questions, they should be told the answer in a way that is appropriate for their age and level of understanding. So obviously, if it's a 6-year-old, you would just say, it's just mommy on your own that adopted you. You haven't got a daddy because I don't have a husband. That's why you haven't got a daddy. But when a child is 15, you tell them the rest of the story as it is. Yeah.
Okay, now just move on. It says, somebody says here, how do you give closure when they want to know their birth parents and they don't know? How do we give closure? Dr. Jibril, do you have anything to say about that?
Well, I think you just have to piggybacking on what Mrs. Obasanya just said. You just have to admit the limitations of what you know and what you don't know. To say that, look, in life, it's not all the time that we have all the answers, right? And that I simply don't know. We don't know. We will make efforts to find out. But for now, we have to deal with it, because in life, there are many situations that, for instance, if armed robbers come to your house and they take some things and all of that, the crime may never be solved. You can't go through life wondering, but who was it that came to my house? You have to deal with some situations in life that you will not have the answers, and you just have to move on so that you can find closure. But you can reassure them that as they grow older, you will support them to make some efforts to try and see if you can unravel things better, It may not work, but I mean, Alex Haley that wrote Roots was able to embark. His life ambition was to trace his roots back to Gambia, and after several generations, he was successful. So things like that can be used to give some hope that down the line in the future you can make efforts, you may be successful, but at the moment this is where we are. That's what I will say. Thank you.
And love fills that gap. It helps. It might not be perfect, but it helps. Somebody says here, how do you manage the dialogue with a 14-year-old child who tells the adopted father, you're not my father, you can't tell me what to do. It is not my fault you could not have biological children. That's a hurting child there. Mrs. Ndu, did you hear that? And can you speak to that, please? How do you manage the dialogue with a 14-year-old child who tells the adopted father, you're not my father? Okay, you did. Okay.
Yes, I heard you perfectly. The truth is that can come from any 14-year-old child. It can come from a biological one. It can come from an adoptive one. The truth, that place, that transition, that adolescence period is usually a place where there's a lot of aggression and trying to, this is me, establish, I have, So I personally would take it as what any teenager would say, not because he's adopted or not adopted. Your biological children can even tell you things that are worse. Your biological children can give you challenges and that are much, much more hurtful. Yeah, so for me, I would treat it more like, okay, that's it. Young adulthood or pre-adulthood or adolescence. There we go. You're trying to throw your weight around. Okay, you're a big boy, you're a big girl. Okay, you don't need your mommy, you don't need your daddy. That's all they're trying to say. And once you look at it in that context, it's not because he's adopted or not adopted. It is because he's a teenager. Teenagers are usually in that place where they are confrontational and they are keen on saying hurtful things just to establish their independence. Precisely, to establish their independence and I'm on top of it. That's what, for me, that's the way I'd look at it. Maybe because I have children, I have passed through that stage. So I don't think you should let it trouble you because he's adopted. That is it's a phase that most young adults and adolescents go through, and it will pass.
Yes. Yeah. And we can't overemphasize the point Mrs. Ndu has just spoken about. I often hear people say, somebody said to me once, no, I wouldn't adopt what my adopted brother did. And when he told me what he did, it was just normal stuff that any human being does. But, he put it down to adoption. So let's not make too much of a big deal out of it. They're just normal human beings like any other person. Someone says here, if we finally tell him and he changes his mood and character, what do I do? Please help me. Auntie Bami, can we give your telephone number to that person?
Yes, no problem.
Don't be afraid. Yes, there could be a negative reaction, but you can manage it and things will turn out better in the end. We've dealt with this in the previous seminar we had 2 weeks ago. So you can get on Joy of Adoption platform on YouTube and you will see that video, but please send your contact details and Mrs. Obasanya will talk to you. I think we have spent quite a bit of time, well above what we had planned to spend. I would like to first, as I close this meeting, thank very much Dr. Jibril Abdulmalik. Thank you very much for coming on at very short notice indeed. Thank you, Professor Emel Waje, who put me in touch with him, and he so graciously agreed to come on this platform to speak to us, and we're very grateful for your time. Thank you very much. Mrs. Ndu, thank you. That's a friend and sister, always willing to help where she can. Very grateful for that. And my darling Auntie Bami, how we can't do without you. You've got such a wealth of experience, and I think you must pass it on to all of us so that we know. And there are lots of people on this platform who haven't adopted children, but just want the information because they know they can use it to help somebody else. And so I'd like to encourage everyone to tell the next person, tell your friends, your family members to come on and learn something that they can use to help somebody else. I know that each and every one of us knows at least one person who's adopted a child and can benefit from the information we're passing here and help save a family from being broken. A lot of people do not have the knowledge that they need. And we all know that knowledge is power, and you can save yourself so much heartache and pain if you know exactly what to do. Like Dr. Jibril said, we're not trying to scare you, we're just trying to arm you to be prepared for some of the challenges you could face. And life is full of challenges, whether you adopt a child or not. That's just what life just happens. We have challenges every day. The next meeting would be on the 4th of July. We're going to be having these meetings every 2 weeks until we feel we've passed sufficient information out there that people can go back to. And that will be on the 4th of July, Sunday again. It's always Sunday, the 1st and the 3rd Sunday of every month at 6 p.m. So please pass the message on. And the platform, do follow us on Facebook, Instagram, YouTube. And it's Joy of Adoption. Thank you very much. And if there are any other questions you have we haven't dealt with, please write the questions or send your questions to 0802 0666 025. And thank you all for being so patient. God bless you.
Bless you. Love, love,
Bless
love.
you. Bless you, my sister. Thank you
Bless
very
you.
much.
Yeah, pleasure.
Thank you, Paul.
Thank you.
Thank you.
Bami and everybody else.
Bye.
Very grateful. Well done. Thank you.
Very well done.
Thank you.
Thank you.